of Wereh, because we have two distinguished pathologists in studio with us. That is Dr. Muthoni Kirimi, who is an anatomical pathologist, and Dr. Ruchika Koli, who is a clinical pathologist. Then we will welcome you guys on set. We'll have a bit of introduction, and then we will introduce the video, and then we'll come back to questions. A lovely evening it is wherever you are watching us from, and it is even lovelier here on society. And so today we turn a bit medical and discuss a subject that not many people are very conversant with, and that is pathology. But before I go any further, welcome aboard. My name is Florence Ndongo.
And I am yours, Henry Kuria. In basic terms, pathology is the precise study and diagnosis of a disease. It addresses four components of diseases: the cause, mechanisms of development, structural alterations of the cells, and the consequences of changes.
An average Kenyan is still struggling to understand what pathology is and how An average Kenyan is still struggling to understand what pathology is and how important is the role of the practice in proper medical diagnosis and treatment. Our curiosity led us to conduct random public interviews that confirmed our work.
Or can I say pathology services?
Pathology services.
All right. All right.
So is there any particular place we are supposed to look?
No, we're just supposed to check.
Let's
And
discuss.
these cameras are being controlled on the other side. They will just find us.
All right. Should not get killed by the camera. Or look at the teleprompter here. There's still time. Let's hear what more you want.
Yeah, okay, like pathology, most of the times when you mention pathology, the first figure that comes to my mind is a dead body. So, please demystify pathology, okay? Yeah.
Okay. Because I think that might be a little when you explain what clinical pathology is, what anatomic pathology, I think we're going to end up repeating.
That kind of a thing.
Like I think one question to each person. Otherwise, yeah, we will end up.
A lovely evening it is wherever you are watching us from, and it is even lovelier here in the studio. It is Thursday, and today is the Southeast segment where we bring to you issues affecting the society. And so today we turn a bit medical and discuss a subject that not many people are very conversant with, and that is pathology. But before I go any further, welcome aboard. My name is Florence Ndongo.
And well, indeed, I'm yours, Henry Kuria. In basic terms, pathology is the precise study and diagnosis of a disease. It addresses 4 components of a disease: the cause, mechanisms of development, structural alterations of the cells, and the consequences of changes. Pathology is a very, very wide subject with different classes such as renal pathology, anatomical pathology, clinical pathology, and forensic pathology, but just to name a few.
Well, I know all this may sound too incomprehensible right now, but it should not be a cause to worry, because we have 2 distinguished pathologists in studio with us. That is Jessica Kirimi, who is an anatomical pathologist, and Dr. Ruchika Koli, who is a clinical pathologist. Ladies, welcome to GBS.
Thank you.
Yeah, Henry and I are glad to host you today and to learn all about pathology.
2 doctors.
Yes.
So make sure if you have any kind of disease, they're already kind of vanished right now.
And what is amazing is today you're so alone, and we have 3 lovely ladies on set doing amazing job as pathologists.
I look forward to the show.
Yes.
Dr. Kirimi, maybe to start with you. Who is Dr. Kirimi?
Dr. Kirimi is, as you heard earlier, an anatomic pathologist. In basic, simple terms, this means that I firstly perform postmortems, which is a systematic examination of bodies after death.
Is it that, do you do that on a daily basis?
It's not on a daily basis, but as the need arises. Yes. So that is part of what I do, the examination of bodies after death to determine cause of death. But other than that, the other thing I as an anatomic pathologist do is whenever someone has a growth on any part of the body and the surgeons remove it, then this is usually given to me to analyze under the microscope to determine whether this is cancer, for example, and if it is a cancer, what cancer it is. If it's not cancer, is it an infection, a bacterial or fungal? Yeah.
Dr. Koli.
Yes.
Welcome on set.
Thank you.
Dr. Koli?
Dr. Koli is a young lady who practices clinical pathology from 8 to 5. As Dr. Muthoni has mentioned, I deal slightly differently in blood pathology, which is known as hematology, microbiology, which is the study of microorganisms, such as parasites, fungi, bacteria, and viruses, and also clinical chemistry, which is now looking at the biochemistry of fluids within the human body.
And when people think about pathologists, what comes into mind is very old people sitting behind a microscope and doing a lot of stuff, but you are young ladies, which is amazing. And just tell us, why did you decide to do pathology, to become a pathologist?
I guess for me to answer that question would be that pathology is actually the science behind the cure. As a pathologist, we play a very big role in the management of patients. You find most of the other doctors, the other clinicians, be it the surgeons, be it the gynecologists, the pediatricians, they will always have to work very closely with the pathologist, because the pathologists play a key role in the treatment of most patients. So for me, this was very interesting, because as much as people may not see us dealing with the patients directly, we do actually work a lot with all the other types of doctors. And this is what interested me very much in pathology, because I end up dealing with all kinds of patients. I don't just deal with gynecology patients or just patients going to theater or children, pediatric patients. So it's basically a very broad-based subject, and that is what was actually most attractive.
Maybe for Dr. Koli, did you ever dream when you were a child, you know, this time I always want to be a pilot and the likes? were you saying that you'd love to be a pathologist?
Actually, interestingly, no. As a child, due to all the TV influences around, I wanted to be a lawyer. Growing up, plastic surgeon. So I had very magnificent dreams, but I think now as a clinical pathologist, I am living the dream, and I'm actually living the way I want to. As Dr. Muthoni has described, we are what you can call the consultant's consultant. We may not be at the forefront with the patient, but I feel that the pathologist always is, you know, the last piece of the puzzle. And I enjoy being a clinical pathologist because when we're in the lab and we're assisting in making the diagnosis, there's never a day which doesn't go by when, you know, we sit back and we go, wow, this is the diagnosis in this patient. We have this eureka moment almost on a daily basis. So it's a very fulfilling career. Every day brings with it new challenges, and I think, you know, there's never a dull moment.
All right. Well, today on Sauti segment, we've decided to bring this issue of pathologists or pathology into light. And I know even at home, whenever people think of pathology, they think of these people dissecting dead bodies. But as we are going to learn, things are quite different. But before we discuss further with our two important guests on set, let's first take a quick view of a video that our producer prepared for us.
An average Kenyan is still struggling to understand what pathology is and how important is the role of the practice in proper medical diagnosis and treatment. Our curiosity led us to conduct random public interviews that confirmed our worst fears on this important discipline as far as medical matters are concerned.
To pathology. Yeah, it's basically a study of human emotions. That's as most I can say, as a branch of psychology.
And when it comes back to my basic instincts, I think pathology is, I would say, the study of a cause of a disease. It's a study of like what causes a disease, trying to know where it came up from, and then trying to come up with a solution like medicine or something like that. That's what I come to my basic understanding of the word pathology.
I'm Floresa Barnabas. I study in SIU and I'm a radio presenter there. I do a bongo show. I don't really know what that word is because I've never heard of it. Yeah.
This is my first year in SIU and I study psychology. I think pathology it's all about ways through which people can know about things not being told about, like themselves. Just it's somehow, I should say, it's somehow instincts that people use to know things. Yeah, I think that is it.
Pathology is the study of diseases, I guess, and the organisms that cause them. Yeah, basically. Yeah. Further than that, I don't have a very deep understanding of it.
According to my thinking, I think, I don't know, it's something random. I think it's a study of where you're going to go. Yeah. Okay, actually a path, it's a way that leads you somewhere. So I think pathology is a study of where you're going to be led. Yeah, that's the best I can think.
Pathologists are the doctor's doctor. So it's similar to...
According to Dr. Ahmed Kalebi of Lancet Kenya Pathologists, which is located on 5th Avenue Ngong Road, the confusion often comes because a few people only know the overemphasized forensic pathology often associated with postmortems.
Broadly speaking, pathology is about laboratory testing, using technology to test biological specimens and come up with answers. In fact, the definition of pathology in science is understanding of disease. So pathologists are people who train to understand the disease, while medical doctors are trained to identify the symptoms and to manage. So for example, as a pathologist, my job is to say, what is the diagnosis? What is causing this illness? Advise the doctor. As I said, we are called the doctor's doctor. So the doctors, a lot of the time, know about us. but the patients don't. But also, unfortunately, some doctors even don't know much about pathologies and their value, particularly in this part of the world. So the aspects of pathology that are important is blood testing. We're able to test, for example, malaria, we're able to test leukemias, which are cancers of the blood, certain blood infections, and that is related to hematology. So hematology is a section of pathology that is related to blood testing.
So there are even people with certain conditions with, the blood clotting. See, there are people who, when something cuts them, then it takes long for their blood to clot. It's not a normal scenario. There's a specified time within which blood should clot. But when it is taking time, then we know there's a problem. Those have to be investigated. The people who are on certain, medication, when they want to do certain surgeries, then we would want to know how long does it take the blood to clot. Will it cause a lot of blood loss, or will it cause a lot of hemorrhage internally? And they would have to check those parameters and see that the blood clotting process takes time the way it is supposed to take time. So that also is studied here. I don't know what percentage of wrong diagnosis goes out there, you see. But if you have accreditation, you're following the standard operating procedures as they are stipulated in the international guidelines, then all should go well. As you can see, we do controls of every test we do. There's no test we run without a control. Control tells you that, oh, you've done the right thing or something went wrong. Because control is something you know. When you know it, then the test should come out the way you know it, and the test should come out correctly.
Lack of knowledge on pathology can be very detrimental, especially when a situation presents itself that requires those particular services.
So we have a request form which has been filled by the doctor containing patient's details and what test he wants. And then, of course, there is a sample here which is collected in this tube. So some samples need what we call serum, some need plasma, some need whole blood, right? So the tubes are designed in such a way that we'll be able to get the correct samples that we want. For example, this one needed serum. So serum is also part of blood. All right, but it is when the cells are removed and the plasma is removed, then you have that fluid part which remains, which is called serum. So this is what we have as serum. So it also contains patient's details matching what is put on the record.
Welcome back, viewer. This is Zoom in Africa, and today we are on the Sauti segment, and we have two doctors on set to try and help us, digest the pathology thing into simpler terms and understand it more better and more clearer. Doctor, I would love to know how different is your training from all the rest professionals within the medical fraternity?
Basically, all doctors go through the general medical training, which takes 6 years for you to actually graduate as a general practitioner. But after doing your 6 years, then you then do another 4 years of pathology. In various universities, you could do general pathology where you graduate both as an anatomic pathologist or clinical chemistry, while in other universities, you directly specialize in one of the areas, either clinical chemistry or anatomic pathology. So it's a total of 6 years to be a general doctor, and then a master's program in pathology for 4 years.
10 good years of training.
Yeah, 10 good years, trust me. Watching the first video, we're asking people what is pathology. They don't really understand what it is yet. It is very important in our society, and also to manage and control diseases. What is your take on it? Why do you think people really don't know much about pathology?
I think it's because we haven't really been in the forefront of medicine. In the newspapers or in the media, whenever pathology is discussed, it's usually in relation to either a dead body and there's a postmortem being conducted, or recently on television, if a death is suspicious and you want to do toxicological analysis, then you hear of a pathologist. So I'm not surprised that a lot of Kenyan people do not know what a pathologist does. Yet we play a very key role, as you say, in diagnosis. Hopefully through this segment and hopefully through what we are doing, Kenyans will come to understand that the laboratory test that their doctor uses in their management who does it, how it's done, and who the pathologist is behind the scene, and the very important role that they play.
Maybe another question of which would arise to this, on what we are discussing, is why do we have very few pathologists in the country, and especially now within the government sector?
Probably just to add a little bit more on to what Dr. Coley said, pathology is not, as children are growing up, when you talk about doctors, to them doctors are the people with white coats and the stethoscopes hanging around their necks. Doctors to them are not really pathologists. So you find it's not just the children, even as people grow older, the other clinical areas, the gynecology, the pediatrics, there's a lot more glamour associated with it. You're out there with your patients. We as pathologists don't tend to really interact that much with patients. We interact more with their samples. So you find most people don't know much about pathology. So even those doing medicine, you find pathology is not something that's attractive to them. They don't want to just sit behind microscopes and to be behind the scenes, so to speak. They're not there in the forefront, dealing directly with the patients. So you find it's not a very popular, most people want to be out there with the patients. Most of the doctors who are thinking of what speciality to go into would prefer something that's out there in the forefront.
Coming back to my question then, why do we have very few pathologists in the country? Or is it that they're there but we do not kind of know about them?
It's true that there are a few pathologists, and that's not just in the country, it's worldwide. There are very few pathologists, and basically I just tend to think it's because it's a speciality that's not associated with a lot of recognition, so to speak. When a patient comes in to see a doctor and they have, for example, a growth somewhere on the arm, the doctor will take them to theater and take it out. The patient just knows this doctor who cut out this growth. The patient does not know that there's a pathologist who will be given that growth to analyze it and will give back a report saying, oh, this is cancer or it is not. They will just go back to their doctor and the doctor will read out the report. So you find the patients never ever get to know that there's a pathologist behind the scenes. And I guess if you want to be more involved with patients directly, then pathology is not for you. And unfortunately, I guess most of the medical health workers want to be more in contact with the patients. So it's not really, most don't find it an attractive speciality. And that could be the reason why there are not too many people interested in it.
And now that's the reality that indeed we have a very few pathologists, not only in Kenya but Africa and perhaps the rest of the world. How does this affect other areas of maybe the doctors, because now you're the doctors of the doctors? How does that affect the process? Is it maybe slower when maybe trying to find cure or trying to know this patient is suffering from this kind of a disease? When you guys are, when pathologists are very few, what are the effects?
Unfortunately, I mean, in Kenya, you'll find that there are very few good laboratory practices. When I say good, I mean laboratories which actually give out quality results which are beneficial to the patient. You'll find a lot of small, if I can call them kiosks, which are opened up as laboratories. Yet when you go in and actually see what they are doing, it's not a quality service that they're providing. It's actually a disservice. Unfortunately, with the few numbers that we are, you find that there are more of these suboptimal or sub-quality laboratories. We are trying to change that practice. It's an uphill task. It's going to take some time, but we're trying to make what we do more known out there. We're trying to make patients and their doctors understand that without a good pathology result, you can't really assist a patient in the manner that you would like to. Hopefully, you know, by not really advertising, but sort of exposing others to what we do, getting them interested and moving them away, demystifying the whole pathology. We should uplift our services in the country so that wherever you are, you don't have to travel all the way to Nairobi to make sure that you get to see a pathologist or your sample is seen by a pathologist. But out there, the services do become available and everyone can access them.
Yeah, one day I had an interaction with a government pathologist, and as we were talking, you know, I asked him what is the best part of his job, and he told me the best, what I love about my profession best is that I deal with dead people, and so I don't have to they don't put pressure on me. I don't have pressure on me. But maybe for Dr. Klimi, which is what do you enjoy most about your work?
What I enjoy most, first and foremost, for example, with the performing of postmortems, is actually when you examine a body and you discover what was the cause of death, and your discovery will actually help these healthcare professionals, the doctors who are looking after the patients, discover this is what caused the death. Next time I have a case like this, I will know this is likely to happen and lead to death. You know, finding out, determining the cause of death, and that being a lesson or you know, a lesson to the clinicians of what really caused this, and probably that knowledge can help in a different case, in a different scenario. I think it's also very satisfying for, even if it's like cases of sudden death, that the family is not settled. You find the family members, the person was healthy and they just passed on. It's really good when you've determined the cause of death and you can sit down a family and explain that it is 1, 2, 3, that there's some closure. You know, people don't go thinking it's witchcraft, or at least there's an explanation that this is what caused the death. There's closure. It's very satisfying to actually be able to give such relatives of deceased, you know, a medical cause of, for example, sudden death. It's also very satisfying, for example, when a patient presents with a growth that everyone thinks is, for example, a cancer, and probably if there was no pathologist, this patient might start like chemotherapy or radiotherapy. But because we are there and we examine it, and for example, we find out it's just TB that's causing this growth, and this patient actually can be spared, you know, the chemo and the chemotherapy and radiotherapy. So it's very satisfying to know at the end of the day that we are playing a very big role in the treatment choices of patients.
You know, when people, a lot of people, even right now, when they think of pathologists, they think of dead people, and a lot of people are even now very scared of dead people. I don't know why. I too am sometimes scared. I don't know why. What was your experience the first time, or were you like prepared mentally? Maybe in my work I'll be meeting dead people. Is it that scary as people would want to think?
Okay, to begin with, my first encounter with systematic examination of a corpse or a dead body was in my first year of medical school. Granted, the first time is a bit unsettling, but it was not too unsettling to totally put me off, you know, later on specializing in postmortems. It's true, most people are totally unsettled by dead bodies, but for me, these are just my patients. It's just that they don't speak and they are dead, but they are still my patients, and I still view them as my patients whom I need to determine what the cause of death was. So for me, I totally disconnect myself from this just being another dead body. This is a patient for me.
Okay. And maybe for Dr. Colley, you are spared the agony of dead bodies, but speaking about the samples and the lab test and everything, many at times people feel these tests are too expensive because once you draw blood and then you're told you have to pay 5,000, 10,000 just for one test. Why the cost of these tests?
That's actually a very good question. It is true that tests are variable in price. You have the ones which are more expensive than the others. And that's because of the technology we use when we examine these cells and we assist in coming up with a diagnosis. Not every sample that we receive in the laboratory is simply put in a machine and the result is printed out at the end. There are a lot of specialized tests that we now carry out, what we call molecular tests, PCR-based tests, DNA-based tests, and unfortunately the technology involved in analyzing these specimens is expensive. Again, it's very important to understand that, as was mentioned in the clip earlier, we just don't run a test on its own. We have to make sure that when we're running the test, the machine that we're running it on is working as it should, and the result that we get actually correlates with the patient's clinical condition. So we have to run controls with every sample. We don't want to just be giving out results, yet they are not beneficial to the patient. All this adds up to the cost. Again, every test run in the laboratory is run by a trained technician or technologist who is overseen by a pathologist. All these individuals have years of training, years of experience. So, we have to take into consideration that when we're releasing one test, there's a lot of technology, a lot of analytical processes that go into it. And in some cases, the tests tend to be more expensive. But, with awareness and with doctors understanding the importance of testing individuals and practicing evidence-based medicine, the cost of the tests will come down. And as we progress and we use these tests more, they will become affordable.
We do have an SMS line which is 21144. If you have any question for our guest on set, kindly send them to us on 21144 and we will be glad to sample them for you. And someone is asking, is there a risk of wrong diagnosis?
And is it true that lady pathologists have more time to themselves as they are never on call? Maybe to start with Dr. Corey, wrong diagnosis.
We have a lot of checks and balances in the laboratory which prevent wrong diagnosis. Also, in clinical pathology, we have what we call a system of stratified testing, where each test that we perform has a specific sensitivity and specificity for the diagnosis that we're trying to find out, thereby minimizing the errors. Again, we've come up with systems whereby human error is minimized. All the systems in the laboratory are now, the laboratories are becoming paperless. So each step is governed, each step is controlled, each step can be audited. Again, minimizing, human errors, pipetting errors, wrong patient, wrong sample. Everything is now controlled with a computer system. So as technology advances, the percentage of errors are also going down. And by the time we're actually giving out a diagnosis or we're giving out a result to a patient, there's so many checks and balances that have been put in place. And we work as a team. We discuss with our doctors, we discuss together as colleagues. So it's a consensus diagnosis that we give out.
Just on that same point.
Yes.
We saw in the clip that you do receive kind of the samples and the requests that come with it.
Yes.
So is there a probability whereby the doctor would be wrong in terms of detecting the disease and he would request for such a test, yet in the lab you may feel this test is not feasible? Or actually, how do you go about that?
We communicate a lot with the doctors. When a patient comes in and a specific test is requested, we discuss with the doctor what is the clinical condition in this patient, is it a relevant test, are there better tests that we actually have available, and even when we do run a test with the result, we go back with the doctor, we have a discussion so that we optimize the laboratory tests for the patient to ensure that what the doctor is actually looking for, we either rule it out or with further tests we can actually say, yes, that was actually the problem. So there's a lot of communication back and forth between us and the consultants.
8 to 5, you said you're working all the time, yet someone is asking, are you guys never on call? So maybe you have a lot of time to yourselves, as maybe one of our viewers would think.
Well, to answer that, it's true as pathologists we don't have very many emergencies and on call, being called out any hours of the night. But that said, as you mentioned earlier, there is a shortage of pathologists, and the workload is quite a lot. Yeah? So as much as we may not have night calls and emergencies, just the amount of work that needs to be done is truly keeping we pathologists busy, even though we don't do the night hours and emergencies.
And then I would want to know, at Lancet, for who, like, maybe we know about Kenyatta and other hospitals, where do you perhaps get the request from any kind of hospital or the big national hospitals?
We actually service all Kenyans from all walks of lives. So we receive specimens from every hospital, every individual doctor, every clinic, every health center. Our business is purely pathology, and we want to make sure that the services that we give out there are of true quality and of true benefit. So we don't narrow ourselves to a particular doctor or a particular, group of patients. Anybody who needs our services is most welcome.
Actually, viewers, this is Zoom in Africa, and today we are very glad to be discussing on the issue of pathology, of which affects everybody's day-to-day life, because once you get sick, the doctor has to do some diagnosis, and behind the diagnosis we find people who have to analyze and try and find out actually what is the cause of this disease. And if you have any views, comments and questions, we still request you to send them through the SMS line of 21144. But actually, before we go any further into this discussion, we'd love to have a second video, then we'll get back to you. Please stay tuned to GBS.
There are many kinds of pathologists. Chemical pathologists can test hundreds of chemicals in the body fluids very accurately. For example, sugar for diabetes, cholesterol and hormones for thyroid disorders, fertility and menopause.
There is what we call chemical pathology. In other words, you're looking at various chemicals in blood to determine their levels. Are they abnormal or normal? Are they related to some external drugs or toxins or poisoning? And that is called chemical pathology. So for example, if somebody has renal failure, the kidney is important to excrete and to clean the blood system. If the kidney fails, certain chemicals will increase in blood. So by doing chemical pathology, you're able to say kidney has failed or not. The liver, the same. If the liver has failed and it has a problem, a similar thing can happen, but you're able to assess.
The things that are in our body that are dissolved into the blood, or that are found in the blood, what are those things? Like enzymes, for example, like certain electrolytes, what we call the sodium, the potassium, the chlorides. Those are things that are found in our bodies. All right? And when your heart is sick, there are things that are found in the blood that would indicate that your heart is sick. They're called cardiac enzymes. The heart will be releasing certain enzymes, which when you analyze in the blood of that particular patient, you find that they are high. That will indicate a heart condition.
Blood and urine samples are the most common samples taken, but you also get others such as skin and body tissue samples, pap smears and spinal fluid. Pathology tests can tell a doctor what is wrong with the patient for timely treatment in order to avoid later complications.
542.6 grams, 20 by 110 by 70 millimeters. Every sample has been done, and also other body fluids. Like we can have aspirate pus from somewhere, and we use that pus to microorganism is here. What antibiotic can we use to treat this kind of a condition? Right?
Microbiologists grow bacteria that causes infections in your body and advise the doctor about the best antibiotics to use. They do serology tests for antibodies to detect diseases like bilharziosis, hepatitis and HIV.
Microbiology, now we study the microorganisms. The microorganisms in specimens, right? Yeah, so those microorganisms and parasites. In other words, right? Remember, you come from the blood now to the solvents within the blood serum and the plasma, and now into the microorganisms. You know, in the body you have so many areas that can be infested by microorganisms, right? Say someone is having an eye, you're having pus, you know, or some discharge from the eye. That could be due to a microorganism. So what do? We do what we call a swab, right? So that becomes a specimen for microbiological examination.
Hematologists look at blood cells through microscopes to diagnose anemia, malaria, and leukemia. They count the blood cells with the help of complicated and often very expensive machines. Once your tests are completed, the pathologist sends a report to your doctor. Often the report will advise on treatment or more laboratory tests required. The doctor can then prescribe the best possible treatment and medication to make a person feel well again.
Now, histopathology is what we study under the microscope. We look at the tissues, for example, somebody with a breast cancer, somebody with intestinal cancer, brain cancer. We're able to say, this is the type of cancer, this is the way it will behave, and this is the best drug to use. And there's a lot of advancement in that. So, for example, that's what I tend to engage on most of the time. And then there are other areas of pathology as well, such as virology, which is study of disease, study of viruses. There's immunology, which is looking at the immune system and different antibodies. So pathology is actually quite wide. But I'm sure, as you saw in our laboratory, there are particular sections. Now, a pathology laboratory is where the analysis happens. And that's why the technologists and the pathologists are best. However, it's a very complex ecosystem, if I may use that word.
Actually, thank you viewer for keeping tuned to GBS. And today is the Sauti segment of Zoom in Africa. With me, Henry and Florence are two doctors, actually pathologists with us on set. And I would love to ask doctors, since you deal with diseases each and every day, has Lancet Lab, is there anything that you boast of, like a very unique case that you've been able to pick out from all the rest of the hospitals?
I think, like I said, every day is an exciting day for us at Lancet. We may not have discovered the next drug, but on a daily basis, we make diagnoses in patients which are rare. That's very exciting and thrilling for us because not only have we helped the patient, but next time we see such a similar case, we're already aware of it. We're making the clinicians aware of it to look for that in their patients. So yes, it may not be a brilliant, ground-shattering discovery every day, but definitely not a day goes by where we don't face a challenge or come up with an amazing diagnosis.
And as we said earlier too, 1144 is our SMS line, and this had been discussed earlier, but one wants to know, what is the difference between forensic pathology and anatomical, since both involve death? Is it the same thing?
Okay, to answer that question, the term forensic basically encompasses all matters concerned with medical legal issues. So a forensic pathologist basically deals with medical legal postmortems. By that I mean postmortems on bodies that have been involved in homicides, suicides, any violent deaths, any suspicious deaths in which there is a medical legal aspect to it. Now, anatomic pathology, on the other side, there are other types of postmortems that can be done, like medical postmortems, in which there are no medical legal issues. This might have been a sick person who's been admitted in hospital, and the family members or the doctors are curious just to find out what the cause of death was. So that's a medical postmortem, and that can be done by basically anatomic pathologists. But forensic pathologists deal more with those postmortems that have medical legal issues.
Okay. And maybe to ask, since everything is in one way changing as we go by trends, you know, what are the evolving aspect? What is the evolving aspect of pathology as per now in the country?
Actually, pathology is taking a very exciting route as we speak. Diagnosis now is no longer just with microscopes and with simple chemical analysis. We are heading towards the direction of molecular analysis, whereby we go in, and if you have an abnormal cell, we can, for example, in leukemias, we can actually go in and have a closer look at this abnormal cell, have a look at the proteins on the surface of this abnormal cell, and with confidence say that this is a specific type of leukemia. With that now, in medicine, it's evolving to what we call targeted therapy, so that when we identify and characterize an abnormal cell, there are newer medicines which are actually being manufactured against these specific cancers. Whereby with the old chemotherapy, patients used to undergo a lot of side effects and used to be hospitalized. But now chemotherapy is almost as if you're treating any other chronic disease like blood pressure or diabetes. Targeted therapy through targeted diagnosis is now the forefront and the future of medicine. And pathology plays a very key role in that. Because without knowing the science behind the disease, the mechanism behind the disease, newer drugs cannot get evolved. So they are exciting times, not only for pathology in the world, but even pathology in Kenya.
And when samples are brought to you, how long does it take? How long does a patient have to wait for the results?
It depends. It depends on which test we're doing. Some results can actually be out within an hour. Some take slightly longer because of the process that we have to take them through the analysis procedures. But some results are actually very fast. Within an hour, one can get a result.
Okay, we have less than 7 minutes left and we have to do a couple of SMSs. The first one doesn't say where and who it is, but how much for a general blood test?
And then we have another one there asking, do you get nightmares being women? I'm really proud of them.
And how long have you been in practice? So let's begin with the very first one. Maybe for Dr. Coley, who deals with samples on a day-to-day basis, how much would it go for maybe a general test for blood?
Okay, again, one would have to be specific which blood test. Okay. If it's a malaria test, it can be around 200 to 300 shillings. But if it's a comprehensive panel whereby we're looking at all, let's say your liver function tests, which comprise about 8 to 9 tests, that may be slightly more expensive at around, maybe around 2,000 shillings.
The second SMS was about you being women, and they're asking that you get nightmares, especially for you, and I know what is in their mind is the dead bodies. They're asking about having nightmares.
I know there's a lot of mystery around dead bodies, but as I had said earlier, for me, I don't view these as just dead bodies. I view these as my patients. And as I deal with these bodies, that is what is in my mind. I totally detach myself from the mysteriousness of death, the mystery of death. For me, I take it as my patient, and so I definitely do not have nightmares.
And maybe for the viewer out there, so that at least we may be able now to break down pathology for them in a simpler way. Is it that only doctors are the pathologists, or the whole process of diagnosis who are actually involved?
Okay, we are actually a team who work in the laboratory. We have the technologists who are actually involved in running the tests. The pathologists come in for the overall interpretation, speaking with the doctor, and in the case of Dr. Kirimi, actually, sitting with the slides from the tissues, assessing, the different patterns of disease and coming up with the diagnosis. But it is a team effort. I mean, there are a lot of other individuals in the background who run the tests, make sure the machines are working as they should, run the controls for every specimen, once the tissues come in, dissect the tissues, make the slides. So it's a huge team and a huge effort that goes into producing a result.
Another one is asking, when you go to the hospital, do the patient request for the tests, or is it the doctor who gets the tests?
Ideally, in most cases, when a patient goes in to see the doctor, it's the doctor, from examining the patient, who decides which are the most appropriate tests that will actually help him come up with a diagnosis. That said, currently we are seeing quite a number of very knowledgeable people out there who know, for example, tests like pap smears, which you do not really need a doctor to prescribe for you. This is just your own you want to just do your own screening, so to speak, you know, for prevention of cancer. So because of, there's a lot of awareness being created, for example, about cancer of the cervix or cancer of the breast. So sometimes we do get patients walking in themselves and requesting. There are tests that really do not require a doctor to request for. We do have walk-ins, but most of the times the tests we do are requested by doctors after examining the patient.
Okay, we still have to go to the post-mortem in one way or another. Pathologists, we see that especially on the legal aspect, they play a very big role. And this is a sector of which corruption in one way or another has taken role. I don't know, what is your take on this, especially on altering the results at the final end of it?
My take on this is most of the medical, legal, or forensic pathology that's currently being done in the country is based on government laboratories, which I believe are doing a very good job. It would be very difficult for me to comment about their processes and procedure because I work in a private, in the private sector, but I do believe they are doing a good job, and yeah.
Okay, hard one to crack.
What are some of the, let's say, some of the most interesting maybe episodes or things that you've gone through that perhaps you cannot forget while at your line of duty?
One of the things, for example, I remember is there's a young girl who presented with an enlarged abdomen, and the family was very convinced this is witchcraft. It's definitely witchcraft. And the lady went in for surgery, and this growth was taken out of the abdomen. And it was brought to us, we examined it. It's what we call, it was a tumor arising from the ovary. And I remember sitting the father and the mother and the older siblings and showing them what really was taken out and explaining to them how this comes about. And the relief on their faces that this is not witchcraft, and someone has actually taken the time to explain what this is. For me, that was very satisfying because I knew this family now is at peace.
Yeah.
Okay.
Yeah.
Time is against us, but from you, Dr. Coley, where exactly are you located? Because people actually would be interested to do that.
Our location of the lab?
Yeah.
Okay, we are based on 5th Gong Road, on the 8th floor, and our main laboratory is also on the ground floor at Pathology Lancet, Kenya. Those are our main offices, but we do have offices all over Kenya, in all the major towns and cities in Kenya.
Okay, maybe your parting shot for the viewers out there.
My parting shot is that pathologists are playing a key role in making diagnosis and in the management of patients. For most people out there who do not know who pathologists are, today you've actually met us. We do exist. We may work behind the scenes, but most of the times the results you get from the laboratory is through efforts of pathologists like Dr. Coley and myself.
Okay. Thank you. Those have been the doctors and specifically the pathologists, and since we have to give them time to go and do other things, for Dr. Coley, she has to go and grow organisms in the lab. Maybe for Dr. Budoni, she has to go back and check out on those growth and extract some samples from the dead bodies. But mind you, it is an enjoyable job. I didn't say that, they say that. I have been your host, Henry Maina. Until tomorrow, enjoy the rest of your viewing.
My name is Florence No. Good night and God bless you.